Well, experts continue to tell us our kids are not going to live as long as us. Our kids are going to die before us. We're going to be standing at graveside burying our children if we continue to go in the direction we're going. And what's going on here? Well, the OBGYNs have failed us terribly. The pediatricians have failed us terribly. Think about it. We have all these terrible birth defects. We rank 41st in the world when it comes to live births and first-month survivability of our babies. 41st. We spend more money for health care than all the other nations of the world combined each year. We rank 41st when it comes to live births and first-month survivability of our baby. Doesn't sound right. We're 92nd in healthfulness. There's 91 other countries whose people live longer than us, who are healthier than us. We rank 60th in longevity. 59 other countries live longer than us. What's going on? Well, when you look at it, why is our kids going to die before us? Well, gluten intolerance has raised its ugly head, has reared its ugly head. And in some communities, as high as 80%. In some communities, it's 30%. Some communities, 50%. But it's a significant thing. It's so significant that every grocery store has at least one, maybe two gluten-free aisles. That's because there's such demand for it. We actually, through Youngevity, have Valerie's gluten-free cookbook. Everybody loves it. Okay? And so gluten is a big problem. You got to get rid of the wheat, barley, rye, and oats out of their life. Got to go to rice and baked sweet potatoes and millet and buckwheat, which is not wheat. And then the fastest age group that's growing when it comes to the numbers of MS, multiple sclerosis patients, is under the age of 12. We're getting now babies that are less than 2 years old getting MS, multiple sclerosis, and it used to be a disease of people between 35 and 50. What's going on there? Well, I'll tell you in a minute. Then there's stroke, thrombotic stroke, blood clots in the brain. The fastest growing age group that have more stroke than anybody else is below 18 years of age. Why is that? Nobody supplements their kids with omega-3 essential fatty acids, and thrombotic stroke, coronary thrombosis, pulmonary embolism, and deep vein thrombosis are all due to omega-3 essential fatty acid deficiencies or ratio problems between omega-3, 6s, and 9s. Rickets is making a big comeback in kids under the age of 10. Rickets in America. That's because doctors, it's a physician-caused disease. Doctors have told us to stay out of the sun. You might get skin cancer. Don't eat egg yolks. Don't eat eggs, where you get vitamin D3 naturally. And, of course, you want to stay away from vitamins because you could overdose on them, according to doctors. So what's a person to do? You're not supposed to get out in the sun. You're not supposed to eat eggs. You're not supposed to take vitamins and minerals. And so rickets is rearing its ugly head. And then there's beriberi and pellagra. These are beriberi is vitamin B1 deficiency. Pellagra is vitamin B3 deficiency. And all these poor kids get gluten intolerance, which gives them eczema and dermatitis anyway. And then you throw in the beriberi because they're not getting thiamine and B1, pellagra, which is a B3 niacin deficiency. And these kids are not getting supplemented, and so they're getting all these emotional problems. ADD, ADHD, autism, and of course they're deficient in most of the minerals. So this is a big problem. Then sports injuries, 1.35 million, 1,350,000 each year sports injuries in American kids. And we're talking about simple things, knee problems, back problems, shoulder problems, and they're just not getting enough nutrition. I want everybody who has a kid or a grandkid or a niece or nephew to get your kids, your nieces, nephews, your grandkids, Dead Athletes Don't Lie, the CD, Serial Killers, the CD, that deals with the gluten intolerance, the hidden place you find gluten, Hell's Kitchen, which looks at type 1 and type 2 diabetes, metabolic syndrome, and obesity. Right now, 70% of our kids under the age of 12 are overweight, and 40% of our kids under the age of 12 are obese, 30 pounds or more of their ideal weight. Hell's Kitchen, the book, and Hell's Kitchen, the CD, for obesity, for type 1 and type 2 diabetes, and also the metabolic syndrome. Energy Crisis. This book and CD actually helps these kids understand their requirements for energy during sporting events. And, of course, they want to get the Rebound sports drink. It has 100 nutrients in it. The others have 1 to 2 to 6 nutrients in it. Our Rebound is the only one with 100 nutrients in it. Okay, so you start out with a Healthy Start Pack. Gives them all 90 essential nutrients in appropriate amounts. Do it by body weight. One Healthy Start Pack is for 100 pounds of human flesh for a month. If they only weigh 50 pounds, you give them half a dose a day. The one Healthy Start Pack will last them 2 months. If they only weigh 25 pounds, you give them a quarter of a dose a day. That one Healthy Start Pack will last them 4 months. I mean, this is not expensive for these kids. Don't forget the Rebound, 100 nutrients, and a great replacer. You can get it non-carbonated in the little sticks, tear them open, put them in a bottle of water. If you want to give them the carbonated cans, they're great. They come in 24 cans in a case, but I would give it to them between meals or after they've had breakfast, say a half hour after breakfast. Don't let them drink the carbonated drinks during meals. Okay, it neutralizes stomach acid and gives them allergies and other problems. Well, we have to protect our kids. Also, according to the Journal of Food Chemistry, came out in April of 2012, said our kids are getting less than 20% of the minerals and vitamins they require. Less than 20%. Dog food has 100%. Chicken food has 100%. Laboratory rat, guinea pig, hamster, and rabbit foods have 100%. Pigs, sheep, and cow food and horse food has 100%. Why do our kids have less than 20%? That's because they're not being supplemented, because pediatricians, of course, are the ones who formulate these baby formulas, things like Gerber's, Enfamil, and Similac. And that's what they call Similac, because it lacks everything. Okay? We got to supplement these kids, otherwise they're in trouble. And then the adults are in trouble. All right, give us a call, 1-888-379-2552, and let's save our kids together. We'll be back after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a bit about turmeric today, as I've got a story from Natural News. Headline: Turmeric improves skin health, protects from UVB radiation damage and aging. And this is all from a couple of studies, one from China, one from Japan, and another from India. And they say that turmeric has a plethora of health benefits: brain boosting, mood enhancing, antidepressant, used extensively in Ayurvedic and Unani, as well as Chinese medicine. Turmeric cures hepatic disorders, that is, conditions caused by inflammation. And topical applications, turmeric is supremely proven to heal skin infections and also treat boils efficiently. They say the natural blood-cleansing, antioxidant, cancer-killing super spice. And a study from China shows that curcumin has the capability to kill triple-negative breast cancer cells by inducing a programmed cell death, apoptosis. And curcumin is also based in treatments that could replace expensive radiation treatments. And turmeric could be used to protect skin cells from damaging effects of radiation treatments. And in a study from Ehime University in Japan, they say the turmeric extract protects skin health from ultraviolet B radiation. They actually looked at the long-term effects of low-dose UVB radiation on melanin processing hairless mice, and they looked at changes such as skin thickness, elasticity, pigmentation, and wrinkling. And they said when they found and put the turmeric to the skin twice daily, they noticed preventative benefits showing up in the skin of the mice. They say dosages of 300 and 1,000 milligrams of turmeric were effective in reducing skin elasticity and induced by ultraviolet radiation. Also prevented an increase in skin thickness. High dosage prevented wrinkle formation. Also decreased the diameter and length of skin blood vessels. Also, in a study in Japan, they put it in a skin cream, where they actually then was formulated to study the effect of recuperating UV radiation damage, and they found that it actually acts as a cellular lubricant. So all very good positive benefits of the use of turmeric.
Of course, we have that in several products, including the Cell Shield RTQ. That's what the T is for, turmeric. And, of course, we love it because 5 of those capsules twice a day, the Cell Shield RTQ is going to give you 100,000 auric points, which gets you up into the range that, as you point out here, that actually protects the cells from free radical damage of all kinds, trans fatty acids, heterocyclic amines, and acrylamides, but also it actually encourages apoptosis in bad cells that are not normal, including cancer cells. Apoptosis is a programmed death, which cancer cells lose. That's why it gets a mass. That's why it grows sometimes as big as a golf ball, as big as a pumpkin. And that's because the mother's cells, the grandmother's cells, the great-grandmother's cells, and the daughter cells never die. They just keep reproducing. And then they get larger than the normal tissue. And that's what's called a tumor. And because they've lost that ability to die, well, you inflict apoptosis on them. And, of course, one of the great natural ways to do it is a great spice. And that's one of the reasons why people on the subcontinent of India have a much lower rate of cancer than the rest of the world, is because the curry and the curcumin, turmeric, is a very, very, historical part of their diet. Very good. Thank you so much. A great story. Well, stick with us. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. All right, Doug, let's go to callers.
Let's head to Maryland. And Miriam, you're on with Dr. Wallach.
Hello, Miriam. You're on the air.
Hi, Dr. Wallach. How are you?
Fine, thank you. How can I help you today?
I'm working with a lady. She's 74 years old, and she's in need of a root canal. And her nutritional status is not all that great. She had colon cancer a couple years ago, had it removed. It was at the intersection of the small and large intestine. And overall, she weighs 80 pounds, has trouble gaining weight. She's taking the Healthy Start Pack, Selenium, Z-Radical. I think that's it.
Okay.
So can you do anything for her?
Sure. How tall is she, do you know?
She's about 5'3", and yes, she has shrunk.
Okay. Very good. Okay, well, what I would do is I start out with, as you say, the one Healthy Start Pack. The selenium, I'd give her, because she has a history of colon cancer, I'd give her 2 of those 3 times a day, 6 a day. That'll be 2 bottles a month. Z-Radical, I'd have her take 2 ounces a day. And because she has a history of dental problems and shrinking, I'd get her on 15 glucogel a day, 5 at breakfast, 5 at dinner, and 5 at bedtime with a glass of water. Wouldn't hurt for her to get an extra quart of Osteo also, so she can take an extra ounce of OsteoX Plus at dinner time, at bedtime, because with that one Healthy Start Pack, she's going to get 1 ounce, which she could have at breakfast, and get another quart, so she could get the second ounce at dinner. She could have a half ounce at breakfast, half ounce at dinner, and then an ounce at bedtime. But I get her that extra quart of the Osteo. And if she has any skin problems or any history of constipation or diarrhea, if she has a history of chronic respiratory problems, or even her kids or brothers and sisters do, I'd get her on a gluten-free diet and help her increase her absorption efficiency, okay?
Right. She had her appendix out, and I know that's...
well, there you go. Yeah, she's got a gluten intolerance if she had her appendix out.
Right, yeah.
Got to be gluten-free, and then she'll be able to absorb a maximum of these things. And she needs to stand barefoot, in the kitchen door jamb on a hard floor, and put a dot on the door jamb like we used to do with kids, see if they're growing. And, every month do it again and see if she's growing, because she should grow in stature if she's absorbing properly and she's taking in this program. Give me a call every 2 weeks. Let me know how this lady's doing. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to South Dakota. And Al, you're on with Dr. Wallach.
Hey, Al, you're on the air.
Hi, Dr. Wallach. Say, I've got a 11-and-a-half-year-old female Great Dane that has 0 blood platelets.
Okay, has what blood platelets?
0.
0. Oh,
yes.
Okay. Well, we have a blood clotting problem. Is this animal hemorrhaging?
She had hurt her foot here about a week and a half ago, and had a hard time getting to stop. And then she got really sick there with a lot of vomiting and that.
Mm-hmm. Okay. How much does this dog weigh?
96 pounds.
Okay, and what's it being fed?
I've got her. They put her on a rice and hamburger diet, and then I've got her cereal, which is formulated for seniors.
Okay, well, let's put the dog on a gluten-free diet, because the odds are it's not absorbing nutrients here. And so I would get it on a gluten-free diet. The rice is a good thing, but I would certainly add the Arthrodex to it. It's 1 scoop for 25 pounds of body weight, so I'd give that dog 4 scoops a day of the Arthrodex. I would also add the de-stress capsules. I'd give that dog 3 or 4 de-stress capsules a day. You just open them up and throw the powder in the food, or if the dog's easy to dose, you can go ahead and throw them down the dog's throat and rub its throat, and it'll swallow them real quick. And
They've also got her on prednisone, 20 milligrams.
Yeah, well, that's the wrong way to go. And does the dog ever limp or have complaints about his back or joints?
No, I put her on Arthrodex like a little over a year ago, and because she was having trouble with her bodily functions. Within 5 days, they were gone. So.
Okay, good. The problems were gone. Excellent. Okay, yeah. And so you want to make sure it's 4 scoops a day, because it's 1 scoop for 25 pounds of body weight. I go ahead and add the de-stress capsules, 3 or 4 of those per day. Just open them up, put them in the food. And also to get the nutrients going, the stem cells going for bone marrow, I'd give that dog a couple ounces of Z-Radical a day, be 2 quarts a month. Just put the Z-Radical right in the food, and it tastes pretty good. Even little kids will like it, so the dog shouldn't object. Okay?
Okay.
We got to get some nutrition into that dog, and I'm not talking about just calories. You know, 96-pound dog is a nice big dog, but I'd go ahead and wouldn't hurt to throw a couple of eggs in there too.
Okay. Can they be raw eggs or?
Yeah, just throw the raw eggs in there, but as long as you're getting the de-stress capsules, because the raw eggs, the egg white does have a avidin, and it will destroy biotin, which you have to supplement it to counteract that. Let me know how that dog's doing, Al.
Okay. I'll call you back in a couple of weeks.
Yeah, perfect. Okay, well, stick with us. We're going to be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Houston, Texas, and Dana, you're on with Dr. Wallach.
Hello, Dana, you're on the air.
Hi, Dr. Wallach.
Hi.
My question is about type 2 diabetes. My 27-year-old brother was recently diagnosed with type 2 diabetes, and he weighs 217 pounds, and he's 5 feet 6 inches, so he's a little overweight. And,
okay, 5'6", okay. Mm-hmm.
Yeah. His blood pressure is 140/60, and he does not have an asthma history or any constipation.
Mm-hmm.
He did have a rash under his armpits at some point last year that was kind of hard to get rid of. So
okay, how long did that rash last?
I don't know. He said it took a while. I'm guessing maybe like a few weeks.
Oh, okay, 2 weeks. Okay, well, this is a Shar project here. Shar, here we have a 27-year-old young man, type 2 diabetes, 217 pounds, a little bit of kind of like borderline blood pressure in his upper numbers, and overweight. So what would you do for this guy?
He needs 2 healthy blood sugar packs
Okay.
a month. And wouldn't hurt him. Well, yeah. Yeah, he gets the calcium with that anyway. So and the sweeties for the diabetes, and the OsteoFX for the high blood pressure.
Yeah, it's all in the healthy blood sugar pack, right?
Yes, yep.
And what would you do for his weight?
Oh, he could take the ASAP.
Yep, very good. Exactly. So Dana, he'd need 2 healthy blood sugar packs per month. That would allow him to take a full dose of each of the products at breakfast, a full dose of each of the products at dinner time. Just make sure he's taking his fasting blood sugar before he medicates himself each morning so he can adjust his medication as he's been taught to do. As his blood sugar drops, he'll want to take less medication. When he's below 100 for his blood sugar levels for a week without medication, he's an ex-diabetic at that point. He will have to stay on the products, of course, and he will have to continue monitoring his diet. Then, of course, he can lose anywhere from a half a pound to 2 pounds a day by taking 1 dropper full of the ASAP under his tongue 30 minutes before each meal. And it's a good program. Thank you, Shar. Okay, give us a call every couple of weeks, Dana. All right, Doug, let's go to callers.
Let's head to Canada, and Gary, you're on with Dr. Wallach.
Well, Gary, you're on the air.
Hi, Dr. Wallach. I'm calling regarding a patient we have up here. She's been told she has Lyme's disease. She's got brain fog, chronic fatigue, overall soreness in body, hair loss, trouble sleeping, constipation. If I understand it right, up here in Canada, they could not diagnose the Lyme's disease, but she's been to California to a lab, and they told her she has Lyme's disease, and I believe also in New York and Kansas City. And it's reversed.
Well, of course. Number one, I personally don't believe that she's got Lyme's disease.
Okay.
She's got too many other symptoms that suggest another direction. Shar, what would you do for somebody that's constipated, losing her hair? She's got fibromyalgia, kind of sore all over, brain fog.
She's probably got a huge gluten intolerance.
Yep. That would be my start.
And so she's not absorbing anything, so she's going to get a lot of things wrong with her.
Yep. So, Gary, we need to put this lady on a gluten-free diet, and if she's been on one, she needs to get tougher on it. Everybody in her household, if she's married, if she's got kids, dogs, cats, fish, birds, everything in that household has got to be gluten-free because of cross-contamination in the food preparation services, the rugs, the couch, the laundry, the bed, everything. And so the whole household's got to be drop-dead gluten-free. She needs to listen to that CD called Serial Killers. And she's not already on it. In addition to the gluten-free diet, no fried foods, no processed meats, no nitrates, nitrites, no oils, no margarine, mayonnaise, salad dressing, cooking oils. And again, no wheat, barley, rye, and oats of any kind. And then I would also have her take the Smart FX for the brain fog. And for the soreness, I'd have her take some selenium. Okay? What does she weigh?
I'm not sure, but I kind of know how it works per 100.
Per 100 pounds. Very good. Give us a call after you do this for 2 weeks, 4 weeks, 6 weeks. Call us every 2 weeks on this lady, because I'd bet you at dinner that she's going to do well.
So I'm sorry, I didn't get what Char said in the beginning to give her. So Smart FX and selenium.
Yeah, but also get her on a gluten-free diet. That was Char's main thing. Okay, but and she said that, rightfully so, that a person like this is going to get 25 different diseases because they cannot absorb nutrients. So they'll show every nutritional deficiency you can think of. Okay?
Healthy heart and brain pack that you want her to go on then, besides that?
Well, that'll be fine. Yeah, she needs the 90 essential nutrients, so a healthy heart and brain pack wouldn't be bad. That'll cover the waterfront. Okay, buddy, call us at 2 weeks, 4 weeks, 6 weeks. Okay, Doug, let's go to callers.
Let's head to Omaha, Nebraska. And Diane, you're on with Dr. Wallach.
Hello, Diane, you're on the air.
Yes, hi, Dr. Wallach.
Hi.
I wonder what you would recommend to lower the pressure in the eye from glaucoma.
Okay, is this in yourself or somebody else?
Myself.
Okay, and how old are you?
58.
58. Okay, and what do you weigh?
125.
Okay. All right, do you have children?
Yes, I do.
Okay, good. Do they have any health problems?
Nothing severe, just little, nothing serious, I guess.
No asthma, no skin problems, nothing like that?
No asthma, no skin problems, no.
Okay. Well, let's see here. Char, this is a peripheral artery disease in the eye. What would you do for a 125-pound lady that has glaucoma? Oh, one more question, Diane, before Char answers. Do you have any high blood pressure at all?
No, my blood pressure today was extremely low, 112/73.
Okay, do you have any, are you on medications?
Just the drops for the glaucoma.
Okay, good. Well, don't stop them. What you want to do, of course, is every couple of weeks when you start this program, go in and have them take your pressure. As your pressure lowers, the doctor will reduce the amount of drops you take. Let him do that. Okay, Char, what would you give this 125-pound lady?
Well, glaucoma is high blood pressure of the eye, right?
Yep.
So she needs to get on the Healthy Start pack.
And
for the blood pressure, she could be taking...
how about the Ultimate Daily?
Ultimate Daily, okay, to open up her arteries if there's any...
Ultimate Daily, yep. And the 125 pounds, I'd have her take the 3 twice a day. It'd be 1 bottle of the Ultimate Daily per month, 1 Healthy Start pack per month. But I'd get an extra quart of the Osteo so that you can also take an extra ounce of the OsteoFX Plus at bedtime. And then call us every couple of weeks because the pressure in your eye will drop quite rapidly. But don't get off your drops for your glaucoma until the doctor tells you to reduce them, and he'll reduce them gradually. Call us every couple of weeks. Love to hear from you, Diane. Okay, Doug, do we have time to start another one?
Yeah, we're getting ready to go to Colorado Springs, Colorado. And Judy, you're on with Dr. Wallach.
Hello, Judy, you're on the air.
Hi, Dr. Wallach. Thank you for taking my call.
You bet.
I was recently diagnosed with trigeminal neuralgia type 2.
Mm-hmm. Okay,
and I was wondering well, that's a biggie for me. I'm on Lyrica now. I'm not happy about it. But
yeah. Okay. How old are you, Judy?
58.
Okay. Do you have any arthritis?
No, I don't think so.
Any osteoporosis, osteopenia?
No.
Okay. Well, trigeminal neuralgia is a peripheral neuropathy of the 5th cranial nerve. Hang on. We'll be back. We'll give you a great program for this one. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go right back to Colorado and Judy. Let's see here. What do you weigh, Judy?
155.
Okay. How tall are you?
5'3".
Okay. And may I ask a personal question? Were you ever on birth control pills?
For a very short period of time, maybe 4 months at the most.
Okay. May not apply to you, but there's a new study out that shows women double their chances of getting glaucoma if they've ever been on birth control pills. So that's something to, at your age, you wouldn't be worried about that anyway. But for the other ladies out there, if you're on birth control pills, you're at a 50% higher risk of getting glaucoma. So we want to be careful of that. At any rate, 155 pounds, trigeminal neuropathy. Again, the trigeminal nerve, the fifth cranial nerve, comes out from behind the ear, goes over and spreads across the face and the upper jaw, lower jaw, and feels like somebody's sticking you in the face with an ice pick. The French call it tic douloureux, which means very bad pain that comes on a periodic basis. It's not constant usually, but it'll come on you suddenly when that nerve gets pinched. And so what I would do is have you take... well, Shar, you can answer this. What would you do for osteoporosis of the skull?
She needs the Healthy Bone and Joint Pack.
Yeah, very good. And what would you do with that CM cream?
Put it on wherever there's pain.
Okay, well, I'd also take a Q-tip and put it down in her ear because that fifth cranial nerve comes out from behind the ear, and you'll get a certain amount of that CM cream actually go through the tissue and relieve the inflammation around the roots of that nerve. And so anytime you feel like you're going to have an attack, or if you want to be sort of proactive, you can put the CM cream down in your ear 3 times a day. Once when you wake up in the morning, say a half a teaspoon with a Q-tip down in each ear. And then sort of the middle of the day and maybe an hour before bed, that'll give you symptom relief. And as Shar said, you can take a fingerful of the CM cream, put it behind your ear and along the path of the pain in the side of your face and upper jaw, lower jaw. That's going to give you some pain relief. But the Shar is exactly right. The Healthy Bone and Joint Pack to support and promote healthy maintenance, repair of all bones in the body, including the bones in the jaw and the skull. And trigeminal neuropathy should go away forever as long as you stay on the 90 essential nutrients. Give us a call every couple of weeks. Let us know how this is working for you. Okay, Doug, do we have time to start another one? Or
yeah, let's head to Boise, Idaho. And Milena, you're on with Dr. Wallach.
Hello, Elena. You're on the air.
Hi, this is Milena. About a month ago, I had an MRI, and they show that there's a cartilage tear on my hip, and then there's a place where there's no cartilage. So, of course, they want to do a hip replacement, but I really want to give the glucogel and the minerals a chance.
Okay, what do you weigh?
But they said...
well, we know they're lying.
200 at 5'6".
I'm sorry?
200 at 5'6".
Okay, 5'6". Okay, so... they make $78,000 for a hip replacement.
Yeah. My question is, though, I want to try to give all the glucogel a chance, and so I want to give it till next May.
Okay,
but
that's
in
fair.
the process, it really hurts to walk, and I've got a wedding and concerts to go through, and they said they can give these shots that numb the hip.
Yeah.
Until then, but I'm afraid that shot is going to be counterproductive to doing this
Here's
protocol.
what I would do. And I would go ahead, and I'm going to take this one, Charles, although you can probably do this one, but I'm going to go ahead and take it. I want you to take 2 of the Healthy Bone and Joint Packs per month. Take 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Ontane Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. I want you to get a 3rd bottle of glucogel, so you can take 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime. That'll require an extra bottle of glucogel to go along with the 2 you're going to get with the 2 Healthy Bone and Joint Packs. I would also get, you're going to get 2 bottles of CM cream. You can use that CM cream on your hip, lower back, and that side, and stay away from carbonated drinks. And it wouldn't hurt to do the ASAP. At 5'6", I'd like to see you weigh 145. It wouldn't hurt to lose 50 pounds. And so use the ASAP. Let's lose the weight. By May, you are going to be drop-dead gorgeous. You're going to feel good. And the odds are you will not want to do the hip surgery. Give us a call every 2 weeks, Elena, and let us know how it's going. Well, thank you, everybody. Thank you, Shar. Super job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.